Susan Relf, ophthalmologist at Relf EyeCare Specialist, joins us now. Good morning, doctor. How are you?
I am just fine, thanks. Good morning.
It's wonderful to see you as always. And you're here to talk today about, as you pointed out, maybe not the most exciting, sexiest of topics, but albeit a very important one. We're talking about glaucoma today.
That's right. Glaucoma, we see a lot of it up here. It's fairly common. It's very common among Northern Europeans, as well, including Scandinavians. So that's why we see so much of it.
Why would that be?
Oh, golly, yeah, a genetic predisposition.
Oh, I mean, we're too stupid. We just stared at the sun.
No. Just born that way.
All right.
Glaucoma is a disease where the pressure inside the eye is high enough to damage the optic nerve.
Okay.
And without boring you with all the details, that exact number is different for everybody. Glaucoma is a disease where vision loss happens gradually over many years, very slowly. A person would not know they had it until they were nearly blind. So our job is to pick it up early, treat it appropriately, catching it early, and in which case we're often successful.
Maybe this is a dumb question, but are there symptoms that you can look for and recognize in the early stages that would send you to see somebody like you?
None whatsoever.
Really?
Nothing.
Well, that's
so
scary.
you would not have a clue.
Right.
Which is why it's important to come in for early detection, especially if there's a family history, other risk factors, that sort of thing. If it's picked up early, we're usually very successful in treating it easily, just usually one eye drop once a day.
Okay.
So it's the sort of thing you don't want to miss. And it involves a lot more than just checking the pressure in the eye. There's a whole body of data that we have to look at. And that kind of brings up the next point. This data that we're looking at, a snapshot, a single point in time with all these measurements that we take doesn't tell a whole lot. What really matters is how a person has changed over time. So continuity of care is really important in watching for glaucoma, which is probably true of a lot of other health problems and diseases in general, but specifically for glaucoma, it's important to have a doctor or a team of doctors that knows you, knows your history, knows where you're coming from, knows your family history, understands your concerns, your risk tolerance, and can kind of follow you over time, so that if ever you do get it, we're quick to pick it up and take care of it appropriately.
You're very good at answering the questions that I have before I even ask them. So you've done this before. Well, I'll tell you what, if people would like to schedule an appointment for a checkup with Relf, how do they do so?
They can call our number, 720-3553, or check our website.
That's relfeyecare.com. Relf EyeCare, the best care for your eyes. Dr. Susan Relf has been our guest. Thank you.
Thank you very much, Jason.